Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to my YouTube channel, and it's chemical pathology, and we are going to start the topic tumor markers. Okay, so first of all we should have the idea that what are the tumor markers. So let's start the topic. Tumor markers are the hormones, enzymes or proteins abnormally synthesized and released by the cancer cells or are produced by the host cells in the response to the cancerous growth. So we can say that the tumor markers are hormones, can be hormones, enzymes, peptides or proteins. And when are they produced in the body? They are produced in the body when the cancerous growth occur in the body and the host cells produce them in the response to that cancerous cells. And the next is how the tumor markers can be detected in the body. So the tumor markers are present in the body fluids, blood, cell membranes or in the cytoplasm of cells. Okay, the next is specific characteristics of the ideal tumor markers. We should have the idea about the ideal tumor markers and their characteristics. So let's start the characteristics. The first is the specificity of the single type of cancer. It means that a single type of tumor marker would be specific for the single type of cancer, not for all the types of cancers. Next is high sensitivity and the specificity for the cancer's growth. It means that the tumor marker is highly sensitive for the presence of the tumor growth, cancerous growth or the tumor growth in the body. When there is a cancerous growth in the body, the tumor markers would shows the positive test, and also it shows the amount of the cancerous growth. And the specificity means that when the cancerous growth is absent in the body, then the tumor markers would show the negative test. So it is the sensitivity and the specificity which is shown by the ideal tumor marker. The next is correlation of the marker level with the tumor size. It means that a tumor marker has the relationship with the tumor size. When the tumor size is small, it obviously would show a low level of the tumor marker, and high level would shows the high tumor size. Next is homogeneous, minimal post-translational modifications. And the last one is the short half-life in circulation. The tumor markers would have the short half-life in the blood circulation, and so we can say that we should detect it as soon as possible after the collection of the blood. So these are the characteristics of the ideal tumor markers. The next is roles of tumor markers. Tumor markers determine the risk. It means that if a person want to detect his cancerous growth in the body, then he or she would carry out the investigation of the for the tumor, and by detecting the tumor markers in his or her body fluids and tissues, etc. So it determines the risk, that the person is at risk or not. And also obviously it shows this screen for the early cancer, and which hormones and which markers are used for the early cancer. These are the calcitonin and the occult blood. The next is diagnose a type of the cancer, HCG and catecholamines. A type of cancer can be detected by the specific type of tumor marker or the hormones or peptides secreted from that specific site, like HCG, human gonadotropic hormone, human chorionic gonadotropin, and catecholamines. These would be discussed in the later on slides. The next is estimate the prognosis, and which hormone is used for the prognosis. That is the carbohydrate antigen 125. Predict the response to the therapy, and carbohydrate antigens 15 to 315, carbohydrate antigen 125, PSA and HCG. prostate specific antigen that is used for the prostate cancer, prostate infection, and prostate enlargement, etc. And also they shows the response to the therapy. And the next is monitor for the disease recurrence or the progression. Besides determining the risk, prognosis, diagnosis, and screening, it also shows the recurrence of the disease, and it is the most widely function. It means that when the disease occurs in the body, or the tumor or any infection occur in the body, then it would also give us the idea about the disease recurrence. That when would this disease occur again in the body, and how many chances are there to occur for that disease. Therapeutic selection, it means we can select a specific type of the therapy for the specific type of the tumor by detecting its level in the body, by detecting its presence in the body. So these are the roles of the tumor markers. The next is types of tumor markers. Types of tumor markers, as we have discussed in the definition, that they may be hormones, enzymes, peptides, and they may also be oncofetal antigens and receptors that are present on the cell membrane or in the cytoplasm of cells. And genetic changes can also be a type of the tumor marker. And which hormones can be used as the tumor markers, can shows the tumor. These are the ACG, calcitonin, gastrin, and prolactin. Enzymes are acid phosphatase, alkaline phosphatase, and PSA. Cancer antigen proteins are and glycoproteins are CA125, CA15.3, and CA19. And CA shows the carbohydrate antigens, which may be present on the cell surface of the cancerous cells. The next is metabolites, that are the epinephrine and norepinephrine. Normal proteins are the thyroglobulin. We are going to discuss it in the detail on the next slides. And the next one is the oncofetal antigens, CEA, carcinoembryonic antigen, and alpha fetoprotein. Next are the receptors. These are the receptors, and their presence shows us the tumor in the body. The next is the last one is the genetic changes. It means that when there is a genetic change in the body, genetic drift in the body, then it also shows the presence of the tumor or the cancerous growth in the body. It's like the mutations and translocations. Okay, hopefully, I hope that you understand the types of the tumor markers. So next we are going to start the clinical significance of the tumor markers. We have studied the types of the tumor markers, roles of the tumor markers, and what are the tumor markers. The next one that we would study, it is the clinical significance. This is also discussed in the previous slides, that the tumor what in the slide that shows the roles of the tumor markers. So these are somewhat related to each other, that it shows the diagnostic and prognostic significance, and they act as the diagnostic and prognostic agents. Screening of cancer in asymptomatic individuals, and clinical staging of the cancerous condition. If the person has the cancerous growth in the body, then the tumor markers would show the clinical stage of that cancer. And also the next one is the monitoring during the cancer treatment. If the person is carrying out the is under the treatment for the cancer, then he or she would monitor it through the tumor markers in the body, by detecting its level and presence in the body fluids or in the cells. For early detection of the recurrence of the cancerous process, it's already discussed in the previous slide that um, recurrence of the disease can be detected by the can be find out by the tumor markers, and also for the early detection. So the tumor markers has the roles in the diagnosis, prognosis, risk determination, clinical staging, in the treatment, and in the recurrence and early detection of the diseases. The next is the techniques of the estimation. So as we are studying the medical laboratory technology, and so we should have the idea about the specific disease um, techniques used for that specific disease. So we are starting the topic, subtopic techniques of the estimation, that we are studying the tumor markers. So we should have the idea about the techniques that are used for the determination of the tumor markers in the body. The first one is the immunohistochemistry, if the tumor markers are present on the cell membrane or in the cytoplasm of cell. And the next one is immunochemistry, that is the radioimmunoassay. And the next one is the enzyme immunoassay, LISA. And the last one, second last, is the fluorescence assay. And the last one is the chemiluminescence assay. So these are the techniques that are used for the determination of the tumor markers in the body. The next one is classification of the tumor markers. Classification of the tumor markers is as follows. Tumor associated antigen, there are 7 classes of the tumor markers, and the first one is the tumor associated antigens. These are also called as oncofetal antigens or the proteins. Okay, the as we know that normal cells have their own characteristics, and they have their own specifications, and if the cells becomes abnormal and they are abnormally produced in the body without the needs of the body, then they would have obviously different characteristics of in the body. So the cancer cells, when the cancer cells are produced in the body, they have their own properties, and they produce abnormal products. They produce mutated and altered genes, and obviously genes are involved in the production of the proteins, so the abnormal proteins are produced, and hence the body function is altered depending upon the specific type of tumor in the site of the body. The next is the tumor associated antigens are produced in a large amount in the fetal life, but after the birth, these antigens disappear and are present in a very minute amount in the adults. Oncofetal antigens are produced in the fetus, and they are produced in more increased amount. But when the fetus growth occurs and the person becomes adult, up to that time these are present in a very minute amount in the body. So they are present in the body, but in the very small amount. And when there is cancerous or the tumor growth in the body, then the oncofetal antigens would be increased in a very much amount, increased up to very much amount. The next in the malignant cells, the synthesis of the oncofetal antigen is reactivated, and their concentration in the blood in the cancerous cell is increased. It is obvious that when the cancerous cells, oncofetal antigens would synthesis would be increased, and their levels would be increased, that would be detected in the blood and body fluids, and may also be detected in the tissues and the cells of the body. The next is examples of oncofetal antigens. We have discussed about the oncofetal antigens, what are they and where are they present, and when are they increased in the body. So now is the next is the example of the oncofetal antigens. The first is the carcinoembryonic antigen, which is the tumor marker for these specific types of the cancers in the body. These are gastrointestinal cancer, ovarian cancer, cervical and lung cancer is in the best marker of the colorectal carcinoma. So we should remember it. It is important from the exam point of view, that we can see this MCQ in the paper, that which is the best marker for the colorectal carcinoma. So the carcinoembryonic antigen, CEA, is the best marker for the colorectal carcinoma. The next one, oncofetal antigen, is the alpha fetoprotein. Alpha fetoprotein is increased in the case of the malignant cells in the tumor cells. So it is synthesized by the fetal liver, as we have discussed in the previous slide. The next is the re-expressed in certain types of tumors. When a person has a specific type of the tumor, then he or she would have increased level of the oncofetal antigen in the body, and it would be re-expressed in the increased amount. Normally function as a transport protein and helps to regulate the oncotic pressure in the fetus. So as we have discussed that it is present in the fetus and it helps in regulating the oncotic pressure in the body, but in the normal adult person it is decreased, it is present in a decreased amount. So its high level shows the presence of tumor and cancerous growth in the body. The next is the germ cells, ovaries, testes, tumors, and hepatocellular carcinoma. So the alpha feto protein is, is for the ovarian and testis carcinoma and hepatocellular carcinoma. And the next one is third one, oncofetal antigen, is the tissue polypeptide antigen. Tissue polypeptide antigen, it shows the presence of the tumors and the cancers, uh, which are the types, which are the sites that we can see, and we can get the idea that this site has the cancers, and the tumor is the colonic cancer, breast cancer, and the prostatic cancer. So the tissue polypeptide antigen is a specific tumor marker for the colonic cancer, breast cancer, and the prostatic cancer. The next is other less important antigens. So these three are the most important antigen, and the less important antigens which may also be present and shows the presence of the tumor in the body and the cancers in the body are the pancreatic oncofetal antigens, colonic specific antigen, and beta oncofetal antigen. So these are the types and the examples of the oncofetal antigens, which shows the presence of the tumors and metastasis in the body. The next one is the carbohydrate antigens. This is the second type of the tumor marker in the classification of the tumor markers. These antigens are more specific in determining the site of the tumor. So it is important from the exam point of view that which tumors are the important in determining the site of the tumor. These are the carbohydrate antigens. They are organ and tissue specific. It means if it is present and detected, it shows the presence of the tumor in the specific organ and in specific tissue. Examples of important carbohydrate antigens are Ca125, Ca15-3, 15-3, Ca19-9, and Ca27-29. These all shows the CA for 125, 15, 3, and 27 to 29 shows the breast cancer and also the other types of the cancers, mainly ovarian cancer. CA15, CA125 is a tumor marker for the ovarian cancer, but may also be elevated in the endometrial cancer, fallopian tube cancer, lung cancer, breast cancer, and the gastrointestinal cancer. So CA125 is mostly a tumor marker. We can get the idea from this point that it is mostly increased in the case of the female cancers, like these are the parts of the female reproductive system. And the next one, 15 to 3, is the breast cancer. 19 to 9 is mainly pancreatic cancer, but also colorectal cancer and other types of the gastrointestinal cancers. So mainly it is colon and the pancreas are the parts of the gastrointestinal tract. So CS 19 to 9, we can remember it that CA 19 to 9 is the tumor marker for the gastrointestinal cancers. CA 27 to 29 is the tumor marker for the breast cancer. Okay, so the next one we are going to start is the pregnancy associated antigen, that is the third class of the tumor markers in the body. The next one is the first type is the human chronic gonadotropin beta subunits, beta HCG, that is also called as beta HCG. It is placental hormone and synthesized by the syncytiotrophoblastic cells of the placenta. When the placenta is established in the body, in the female body, it is the cells produced the beta HCG, and it is also detected in the case of the pregnancy and the and also in the it is also detected in the placenta cancer or the tumor, and also maybe in other tumors in the body. In the non-pregnant state, it is present a very minute concentration in the serum, but it is markedly elevated in the pregnancy. Okay, so in the non-pregnant state, in the normal female, it is present in a very small amount, but in the pregnancy, it is elevated in a very high amount, and we can detect a stage of the pregnancy from this. The peak values are attained at the 12th week of their pregnancy, and then it declines slowly and reach 1 to 5th of the peak at the end of the 20 weeks. So we can remember it that it is important from the exam point of view that when is the beta HCG increased, and at the highest level it is the 12th week of the pregnancy, and then it declines to the 20 weeks at the 1 up to the level of 1 by 5th week peak, and continues at a very low level for a few days then after the parturition. Measurement of HCG in the serum and urine is undertaken to diagnose the pregnancy. Okay. The next one is the pregnancy associated antigen, is the type parts and the subunits of the beta HCG. It has two subunits, alpha and beta subunits. The beta subunit is typically measured because of its increased specificity and because some tumor cells secrete only beta subunit. So the HCG has two subunits, alpha and beta, and we call it as a beta subunit because it is the more specific and it is secreted in the increased concentration. Okay, so its high level is an ideal marker for the gestational, trophoblastic, and germ cell tumors of the testes and ovaries. Okay, and the next is its high level is also observed in the seminoma, embryonic carcinoma, teratocarcinoma, and choriocarcinoma. So as it is the female um, hormone, so when the in the pregnancy, it is associated with the placental tumor and cancers, and also um, in the fetal and teratocarcinoma and choriocarcinoma, when the embryo has the carcinoma in its body. So in that cases, beta hcg would also be increased in an abnormal amount, and we can detect that type of the tumor by its level detection. The next one is the placenta like alkaline phosphatase, that is also called as Regan isoenzyme. Regan isoenzyme, the phosphatase that is expressed in the in the number of the human tumors, particularly in the gonadal and urologic cancer. So if the person has gonadal or the urologic cancers, so the Regan isoenzyme, that is the placental type alkaline phosphatase, this enzyme can be increased is increased in these types of the cancers, gonadal and urologic cancers. The next is the pregnancy associated antigen. We have discussed the pregnancy associated antigens that were the placental like alkaline phosphatase, and the first was the beta hcg. That was the most important, and the next are the pregnancy associated antigens. Third type, other antigens, is the human placental lactogen, that is also the placental antigen secreted from the placenta, and it is helpful in detecting the type of the cancer in the during the pregnancy, maybe in the placenta, maybe in the female, or in the baby of the uh, of those pregnant females. The next one is the sex hormone binding protein, that is also the pregnancy associated antigens, steroid binding beta globulin, and alpha 2 pregnancy associated globulin. So these are the types of the pregnancy associated antigens that are increased in the case of the um, abnormal fetus, abnormal embryo, or in the case of the tumors and the cancers of the female placenta or female baby abnormality. So these are carried out in that cases. The next four type and the four class of the tumor marker in the body is the memory associated antigens. It is also the associated and related, and it is the tumor marker of the female that, as the name indicates, memory associated antigens. And there are three types of the memory associated antigen. These are MCA, mucin like carcinoma. Mucin like carcinoma associated antigen, it is used for the breast cancer. As the name indicates, memory, so memory is associated with breast, so these are used for the breast cancers. MSA, memory serum antigen, it is also for the breast cancer. And MAP, mitogen activated protein kinase, for the breast cancer. So there are three tumor markers that are very specifically associated with memory associated antigens. Memory means breast cancer. The next one is the hormone associated antigens, or the tumor markers. Hormone used as the tumor markers means we have studied the proteins antigens and the surface antigens, and also the pregnancy associated antigens. So the next one, as we had discussed, that the tumor markers may be hormones. So next is the hormone. So which hormones are used as a tumor marker are the ACTH, adenocorticotropic hormone, and it is used for which types of the cancer as the lung cancer, medullary carcinoma of the thyroid, and pancreatic carcinoma. Calcitonin for the medullary carcinoma of the thyroid. Calcitonin, as it is the hormone released from the thyroid, so it is the carcinoma of the thyroid. The carcinoma of thyroid can be detected by the calcitonin increased level. Catecholamines from the pheochromocytoma, and the gastrin for the gastrinoma. Gastrinoma, when there is a gastric cancer in the body, then the gastrin can be increased. And the next is insulin for the insulinoma, when the when there is a tumor or the cancer in the insulin secreting part of the pancreas, then insulin would be increased. Glucagon in the glucagonoma, glucagon carcinoma, and serotonin in the carcinoid syndrome. Okay, so the next one we are going to start is the next class, that is the enzymes and isoenzymes used as the tumor markers. Lactate dehydrogenase, we have studied the proteins, enzymes, and antigens. The next we are going to start is the enzymes and isoenzymes which are used as the tumor markers. Lactate dehydrogenase, so we have the different types of the lactate dehydrogenase, that is the total LDH, LDH1, LDH234, and LDH5. Total LDH is increased in which types of the tumors are the lymphoma, leukemia, germ cell tumors, breast cancer, and the lung cancer. LDH1 is the germ cell tumors, ovarian carcinoma, osteocarcinoma, and the LDH234 is increased in the case of leukemias. So the LDH is more related to the lymphomas and leukemias. LDH5 is hepatoma, breast cancer, colorectal cancer, and other benign liver diseases. So it is so we should remember it that it may be observed in the MCUs that in which enzyme tumor marker is increased in the benign liver diseases, that is the LDH5. The next one enzyme is alkaline phosphatase. Alkaline phosphatase is the liver isoenzyme. As we know that all the enzymes are produced in the liver, so it is the liver isoenzyme, and it is increased in the metastatic liver cancer. Okay, the next one is the bone isoenzyme. Metastatic bone disease, as the name indicates, bone isoenzyme, so it would show the cancers and the tumors of the bone. So it is a metastatic bone disease, benign bone disease. And the next one is the Regan isoenzyme. Lung cancer, ovarian cancer, breast cancer, colonic cancer, and the uterine cancers. Mostly the female reproductive parts cancers are related to the Regan isoenzyme. And next, the last one is the nego isoenzyme. It is increased in the metastatic carcinoma of the pleural surfaces. Pleura is related to the lungs protective membranes. So when that part has the metastatic carcinoma, so the nego-isoenzyme would be increased and may be present in a abnormal amount. And the next is adenocarcinoma of the pancreas and the bile duct. Pancreas and bile duct and the pleural surfaces metastatic carcinoma is indicated by the nego-isoenzyme. So these are the enzymes which are used as the tumor markers. The next are the enzymes and isoenzymes. Third type is the acid phosphatase, creatine kinase, alpha 1 antitrypsin, and neuron specific enolase. Acid phosphatase is used for the prostatic acid phosphatase, prostatic cancer. PSA is used for the prostatic cancer. Prostatic risk and diagnosis and screening can be carried out by PSA level in the body. The next is the creatine kinase, that is the CPKBB, adenocarcinoma, prostatic carcinoma. So these are the two hormones, acid phosphatase enzymes, acid phosphatase and creatine kinase may be increased in the case of the prostatic cancer and carcinomas. The next one is the alpha 1 antitrypsin, and the last one is the neuron specific enolase. And alpha 1 antitrypsin is used as a tumor marker for the germ cell tumors of the testes and ovaries. And neuron specific enolase is used for the neuroblastoma and lung cancer. Okay, so these are the enzymes which are used in this tumor marker for the specific types and the specific sites of the tumors and the cancers in the body. Next and the last one, classification, is the miscellaneous tumor markers. These are prostate specific antigens. uh, as the name indicates, it is produced from the it is a prostate specific antigen, so it would be produced from the prostatic ducts, produced in the epithelial cells of the prostatic ducts, and consists of the two forms, free and complexed. So it has the two forms, that are the free and complexed. In the healthy man, some amount of the PSA can be detected. Okay, so it is normally also produced in the normal man, but in the abnormal cases, it would be produced in the very high amount or in the abnormal amount, that would show and give us the idea about the types of the prostatic tumor or the prostatic carcinoma. And the healthy man, okay, PSA is elevated in the prostatic infection, irritation, and benign prostate enlargement. Methodology detects both forms. Okay, so when we are carrying out the investigation of the PSA in the body, so it would give us both the free and the complex forms in the body. Okay, the next one is the protein used to monitor the therapy. Which proteins are used to monitor the therapy, monitoring the treatment of the cancerous therapy, are the beta 2 microglobulin. Beta 2 microglobulin, it would reflect the cell turnover, increased production of the cells, and immunoglobulins, which are the antibodies. So these are the proteins which are used to monitor the therapy.